衞生事務委員會、教育事務委員會同福利事務委員會。
Now we have a quorum, and this is the appointed time, so I call the meeting to order. In accordance with 22K of the House rules, when a joint meeting is to be held between panels to discuss issues of common concerns, we should decide who should chair the meeting. And I'd like to inform members that Professor Joseph Lee, Dr. Ann Chang, respectively being chair of the panel on health services and panel on education, have agreed that I should chair this joint meeting. So if there is no objection, I will be chairing this joint meeting. Thank you for your support. Today, we are going to discuss the mental health of adolescents, and I'll now invite the administration in. Now, members perhaps would also note that, in fact, in relation to mental health of adolescents, for the health services panel, we're going to discuss the enhancement of health services, mental health services, and for the education panel, and also the welfare services panel, the relevant items will be discussed. And that is why we now have this joint meeting to discuss the common issue. I'd like to welcome from the administration Under Secretary for Food and Health and his team from the Food and Health Bureau, and also public officers from the Education Bureau, Hospital Authority, Department of Health and Social Welfare Department. I won't go through the list. We have the attendance list ready. We have a 2-hour meeting today. I suppose members would like to exchange views with the administration and put questions to them, especially on the mental health of adolescents. This issue is very much connected with the issue of student suicides. And I understand that we have a 12-page paper ready from the administration, setting out everything, including free quality kindergarten education policy. Well, Under Secretary, I don't think you can go through the paper in just 5 minutes. So please be succinct. I'll give you 5 minutes. Under Secretary. Thank you. Chairman, members. Mental health of adolescents is an essential part of overall health of the society. And it is also an issue close to the heart of the government and as well as members. Through different policy bureaus and departments, the government promotes cooperation, and we also provide cross-sectoral and multidisciplinary support to our young people. We have a number of key areas, for example, early intervention, prevention, treatment, etc. And last year in April, the government published a report on the review of mental health with recommendations, and also the government also decided to set up an advisory committee on mental health. It promotes multifaceted, it promotes collaboration between education and social welfare and healthcare sectors, with representatives sitting in the committee, including rehabilitants. Of course, one key task of the advisory committee is the mental health of adolescents. In terms of policy implementation and the need for mental health services by adolescents, the advisory committee will assist the government in policy formulation to enhance our mental health service for adolescents. The paper sets out the existing services. I'm not going to repeat them, and I welcome questions from members. Thank you. Thank you, Under Secretary. You only spent 1 minute 45 seconds to walk through the paper. Thank you. Now, many members would like to ask questions. For the first round, I'll give a time limit of 4 minutes. Let me read out the list. Poon Siu Ping, Joseph Lee, Chen Chi-chun, and Claudia Mo. Dr. Helena Wong, Siu Si-wing, and also Dr. Pierre Chen and Dr. Ann Chang. Let's start with Mr. Poon Siu Ping. Thank you, Chairman. I'm reading from the electoral paper. It says that the World Health Organization suggests that for children and adolescents around the world, 10 to 20% of them suffer from mental issues. Now, using the same projection, I want to know whether the government has such statistics for our local population. For young people below the age of 19, we have over 1 million in our population, according to the CNSD. Multiplied by 20%, it means around 200 or 230,000 young people might be suffering from mental illness. Now, according to paragraph 3 of the paper, it says that in 2016-17, the Child and Adolescent Psychiatric Service of the Hospital Authority provided services to over 32,000 children and adolescents. In other words, the service target could be huge, and the HA provided services to about 32,000 target users, among which, according to your paper, about 12,000 were adolescents between the age of 12 and 17. Does it mean that taking out 12,000 from 32,000, are you referring to those below the age of 12 or above 17? That's the first question. Second question, in paragraph 5 of the paper, it says that the Department of Health has student health service to provide health promotion and disease prevention services to primary and secondary school students. Eligible students enrolled in the service will receive annual health assessment designed to cater for the health needs at various stages of development. Now, my question is this: how many of them have been enrolled in the service? And after providing a service, have you collect statistics on the number of cases to be referred for further treatment? And another follow-up question.
In paragraph 40 of your paper, it is said that the CE proposed to set up a committee on prevention of student suicides. Representatives from the LWB, the EDB, the FHB will be included, and a report will be made to the CE by the end of 2018 by the task force. Can that be advanced? Prevention of youth suicide, of course, involves a lot of work, so you need to follow that up as well. So it's about numbers and also about progress of the task force. I'll ask the HA, DH, and the other departments to give a preliminary response. Sorry. The number is correct. There are about 20,000 children, patients who are below 12 years old. So the number has been confirmed. About registration and referral, who is to answer the question? Yes, Dr. Chung of the DH. With regard to student health surveys, every year there are 600,000 primary and secondary school students who are registered. They have an attendance rate of more than 60%, and they are also provided with health examination and assessment, including physical and mental physical examination and mental assessment. If there is any mental problem discovered, there will be follow-up. And every year there are about 3,000 or 4,000 students who have to be referred. 3,000 to 4,000. Okay, 3,000 to 4,000. As for the last part, though the time has expired, can you answer the question briefly concerning a task force led by Dr. Law? Have they started the meeting, and what is the progress? Can that be advanced? LWB. Yes, the AS. Sorry, speaker is not coming through. the task force was based on the final report last year, and in answering the question, we have already listed the progress. We have not heard you. Has the task force started its meeting? Well, they started working in mid-November. As for the final report, in November last year, the recommendations in answering Mr. Michael Tian's question, the progress in respect of those recommendations had already been listed. You started work in mid-November, right? Is it preparatory work? Well, they had a meeting. You asked whether we had a meeting. Yes, there was. So Dr. Law chaired the meeting. Yes. Now they are working. Can that be advanced before the end of 2018? Is about life and limb. Recently, 2 university students killed themselves. Yes, the working group is working. Our target is the end of 2018 in respect of making a report to the CE. We know the demand of the member. The target is the end of 2018. If need be, we can submit the report ASAP. Can you advance it in the mid? Anyways, can you come to us again in middle of 2018 to update us on the progress? Well, it depends on the progress. We understand the members' demand. We are watching this very closely. It's about human lives. It's very important. Next, Dr. Joseph Lee. Thank you, Chairman. I find the numbers very interesting. We can be positive to say that there are 1 million or so children or young people who are mentally healthy. According to the statistics of the WHO, the percentage is 20%. But we have a percentage much less than 20%, so we should be happy. We should rest on. We can just sit on our hands, but of course, you know that's a mockery. You don't have the numbers. I'm not asking a question. I just want to ask the administration whether they do know how many young people, adolescents, or children are suffering from mental health problems and need help. I don't know whether you can answer the question. I know that you will just push the buck. You just pass the buck. We're not talking about mental disorder, but if we are talking about mental issues or delinquent behavior, then it's entirely very different. Now, there may be mental imbalance, and there may be SENs, there may be those who have mental disorder. And that's why we have a joint panel meeting. The purpose of the joint panel meeting is to ask for an interdepartmental arrangement. It is not that steering committee. The member asked you to speed up the process, but I hope that after you have the advisory committee on mental health, you have a progress report to the 3 panels on a quarterly basis to see what has been done. If you have just one meeting per year, then you just have 2 meetings, and by 2020 you can follow everything up. Although we have changed our rules of procedures, we can still put pressure on you and force you to do something. I asked for a quarterly report for each of the panels who are here. And as for the DH, is responsible for coordination. With regard to your student health service, can you expand the coverage to include mental health assessment so that we can understand the problem earlier? It's not just for the primary school students, but also for secondary school students and the university students. Can mental health assessment be included as part of the student health service? Can you expand it to cover secondary and university students? As for the Education Bureau, is mental health covered? Are teachers trained, or at least some teachers are trained in this respect, so that students can face the issue of mental health issues in a healthy manner? The third is to deal with mental disorder. If they have problems, can there be early intervention? Can they have the service of social workers and nurses and other professionals so that there can be early intervention? And also in secondary and primary schools, there should be social workers and nurses who will help the students to deal with mental health positively. I don't have much time. They may not have time to answer my question, and I would like to supplement later. The Undersecretary. First, on the Advisory Committee on Mental Health, we had our first meeting on the 15th of December. Our meeting frequency is not as low as once a year, and the chairman of that committee is very keen on this matter. And the chairman is of the view that youth and adolescent mental health is a priority. If you want us to provide intermediate reports from at suitable junctures, we can do so. As for basic information and survey, well, with regard to mental health, which is a broader subject instead of mental disorder, the DH is planning after the publication of the mental health survey report. We will step up the frequency of the survey, and also the age group should also cover youth and adolescents, and there will also be questions covering mental health elements. This is included in the NCD. As for the questions for the DH and EB, I will leave the questions to them. Now, will mental health examination be included in the student health service? Yes, thank you, Chairman. In fact, there is an assessment, a mental assessment. Whether it's in our department or other colleagues, we are working very closely, and if need be, referrals can be made to the relevant professionals. All right, time is up. We'll follow up later. As for the Advisory Committee on Mental Health, the Undersecretary, I would like to tell you, we want to have a mental health bureau to deal with the issue, but now it's just an advisory committee. And also, there are no representatives of parents, and we cannot accept that. If your progress is slow, and if your transparency is not high, that will cause more worries. Next, Mr. Chen Chi-chun. Thank you, Chairman. Now, this is a joint meeting on the mental health of youth and adolescents. And I don't want to focus on numbers and money. I think we should focus on policy, whether the policy can help a living person. Last week, I came across an example. A university graduate, just a fresh graduate. He had his first job. He was unhappy. The company didn't fire him, but he was asked to leave on his own. Because of that, he had an emotional problem. He waited for outpatient service. If you want to wait for specialist outpatient service, how long will that take? I hope the administration will openly answer the question. He is a graduate. Therefore, he has fallen out of this the scope of this topic. If a student waits for mental health special psychiatric service, will that be shorter? So he has to borrow money. The young person has to borrow money, and he wants to seek help from social worker, but the social workers cannot help. If he has a suicidal inclination, the waiting time will be shorter. Maybe will that be several weeks or several months? And if he's referred to the outpatient, the general outpatient service, then he may be given some psychiatric drugs, which could patch up the situation for the time being. Now we've noticed that paragraph 22 refers to mental health support in the TEIs. But for the fresh graduates who suffer from work pressure, who has just left school and suffering from work pressure and have problems with their jobs and mental health, then who is to help them? Paragraph 22, is it the Legislative paper? By the Legislative Secretariat? No, by the administration. The topic, mental health support provided by TEIs. DH or who? With regard to waiting for outpatient specialist service, our HA representative, Dr. Yu. The HA special clinic has a triage system, and through that triage system, patients who have more immediate needs will be given earlier treatment. We will give emergency, some emergency, and stable. We want to shorten the waiting time for emergency and some emergency cases from 2 weeks to 2 weeks and 8 weeks. So for new cases.
And we have been able to fulfill the performance pledge because there is a keen demand for more stable cases. The waiting time tends to be a bit long. Now, if the patient's condition changes, he's welcome to come back to the specialist outpatient clinic for an assessment to see whether the appointment should be advanced or not. And it is done on a case-by-case basis. What about non-urgent cases? How long will the waiting time be? What's the longest waiting time? And any difference in the waiting time for a young student and a young school leaver? I heard that it's ranging from 2 weeks to 8 weeks. What about non-urgent cases? For children and adolescents, the median waiting time is 69 weeks. That's true. We do not classify patients into whether they're still in school or not. It's done by age. Under the age of 17, they will visit the child and adolescent clinic, whereas above the age of 18, the patient will visit the specialist outpatient clinic for adults. Because of quite a large number of young patients, in recent years we have added this element. We have nurse clinic and allied health professionals at the special outpatient clinics assisting doctors in conducting preliminary assessments so as to expedite the waiting process and also to give proper intervals between follow-up appointments to provide appropriate help to those in need. And through these two new initiatives, we see an improvement in terms of waiting time. 69 weeks for non-urgent young patients below the age of 17, right? Let's say in my case, the person has graduated, so is regarded as an adult. What's the waiting time? For adults, for 90 percentile, the waiting time is 58 weeks. That means 90% of patients could have the first appointment within 58 weeks. So the waiting time is shorter than the queue for young people because the psychiatrists specializing in child and adolescent unlimited number. We in fact have few graduates joining the specialty in the past few years. So from 20, and the number of new cases have increased 50% from 2011 to 2016-17. There is some sort of demand-supply imbalance, and hence the longer waiting time. I know that there will be follow-up questions on this, but let's move on to the next member, Ms. Claudia Mo. Thank you, Chair. Just now I heard that for 20,000 children and adolescents suffering from mental issues, they are below the age of 12. 20,000 of them is such a saddening situation, not just in terms of numbers, but in terms of the mental wellness of young people. So to be regarded as a teenager, one should be at least 13 years old. 13, right? And very easily it will fall outside the scope of our discussion. In fact, the HA has this CNA psychiatric service, but I suspect that they do not cover children above the age of 15, because you cover children, but in fact you should also cover teenagers. And that's my comment. But I have this question. Over the years, I have heard a lot from psychologists in Western countries. Sometimes teenagers may have nature-nurture kids on the block, and apart from psychological issues, they may exhibit behavioral problems. It may come as a result of the nature, or it is a nurtured condition, meaning that the young people may be subject to peer pressure. Now, I don't know, family may constitute a large portion of it. What about peer pressure? Does it also constitute a major cause? And by peer pressure, I mean bullying. When you provide counseling to young people, well, and I would avoid using the term patient, but let's say for this young subject, you may give him emotional counseling, but that's not tackling the problem at source. The source is peer pressure and bullying. Have you included that as well, Under Secretary? First of all, whether this is children below the age of 12 is covered. For CNA Psychiatric Service of HA, it covers people from the age of from newborn to 17 years old. All right, so children are also included. Next point on bullying. Is it also covered by the CNA Psychiatric Service? Or perhaps I'll defer to the Education Bureau. The Education Bureau also looks after children in primary and secondary school. We provide support in this regard. That's it? Just a simple sentence. Let's say I am a child and I am bullied on a daily basis. I'm laughed at, I'm teased, I'm the subject of teasing. Well, let's say if I'm in my teens, and I'm 13, 14, self-image is very important. You say you give support, but I mean whether you will go deep. Would you attend his class, or would you check out the problems he encounters in group activities? Or would you just give him counseling, or just be strong, ignore others, something like that? Because this would be nonsense. You do not tackle the problem at source. Well, our school counseling professional in primary schools, including school guidance teachers, etc., and also social workers in secondary schools, in the face of complex cases like this, would provide assistance on referral by teachers. And in a more complex situation, if more support is needed, the school-based psychologist, along with the social worker, will see if further help is needed. We also have a variety of schemes to enhance resilience among students and their capability of adjusting to adverse situation? So the answer is yes, right? I think Ms. Mo was trying to remind you that you should not stay at the personal level. You should also consider the problem from the perspective of the peers. Next, Dr. Helena Wong. Chairman, we're very concerned. Recently, we have heard a lot of suicide cases of children as well as young students. Now, I asked my friend in the department whether she would be on leave during the Christmas, but the teacher said that she dares not take any leave for fear that the student might commit suicide. I understand from the paper that we have different schemes. For example, from the Department of Health, and also there is a 3-tier support model put forward by the Education Bureau. And just now, according to your replies, support will be given at all levels. Now, for physical checkup in secondary schools, apart from the physical checkup, would mental assessment be conducted? Your answer was affirmative. So I'd like to know what form of students would be involved and how long. For example, an assessment done at a primary certain level and primary and also secondary schools, because for early intervention or identification, I want to make sure that the whole territory will be covered so that the category of mental issues can be identified. I'd like to know how you can pool resources among the bureaus so as to cover all the schools. Make it more frequent. Don't just conduct an assessment and then another after 12 years. What happens if something goes wrong in between? Can you tell us the interval of assessment? And what about the assessment tool? Does it come in the form of a questionnaire? If so, can we have a look at the questionnaire to see how you conduct the identification assessment so that we see whether your early identification is effective or not? Another point about the paragraph 15 of the paper, school-based educational psychology service. The educational psychologists will provide regular visits to schools to provide support to teachers. But in terms of the ratio, the EP to school ratio will be increased progressively to 1:4. Does it mean that one EP would visit 4 schools, will be in charge of 4 schools? I don't think this target is good enough. Would you increase the ratio to 1:2? And what is the existing ratio? How long does it take for you to reach 1:4 or even 1:2? So that you can really provide more support. It's not good enough to rely on teachers, because the teachers need to follow the school curriculum and also to attach importance to the person's whole development, whole person development. How can you provide more support to the students with special needs? I can ask Dr. Zhang to supplement. On student health service, every year students attend our assessment centers for medical checkup. This is done on alternate years. That is P2, P4, P6, and also Form 2, Form 4, and Form 6 on even years. And we have a specific questionnaire on psychological or mental well-being assessment. And when they conduct a physical examination, if a doctor identifies any mental or psychological issues, referrals will be made if necessary. Where is it done? In our health service center. So it covers all students across the territory, P2, P4, P6, right? they can go. I want to know whether they can go or whether they definitely will go. Well, it's done on a voluntary basis. That's the problem, Chairman. If you say this is a voluntary scheme, can you tell me the participation rate for P2, P4, P6 students, Form 2, Form 4, Form 6 students? How many students definitely will go to your assessment? Because if they do not see themselves as having any problems, they won't go. Voluntary participation rate, do you have the figure? Participation rate. We have 90% both for primary and secondary schools. Attendance rate, primary schools we have 80% and secondary schools 50%. Chairman, I want specific figures on the situation. I want to know whether it's accessible or whether one would have to wait for a long time for the assessment. Well, we provide an annual medical check for students. It's done through schools. Enrollment forms will be distributed to students. Before the start of the school year, they would go through the registration process, and then we will assign a date for them to conduct the assessment. Students then will, following the assigned date, come for an assessment. And if any psychological, physical, mental issues are identified, and if referral is necessary, we will follow up on the matter, including referrals. Can you give us a report afterwards on the figures? And will the government consider, at least, making one assessment compulsory, respectively during primary and secondary schools? Can we do that? Do you have the resources to cope with that? We'll go back and consider that. Chairman, what about the EP, educational psychologists? I'll invite the Undersecretary to give you a brief response on the Education Bureau. In this school year, we have increased the ratio from 1 to 4. We are going to increase the number of schools from 30 to 80. We hope that the more schools will reach this ratio, target ratio, but because of recruitment issues, etc., we're still in the process of training EPs. At the moment, for other schools, they stay in the ratio of 1 to 8 or 1 to 7. So one EP serves 4 schools, right? For 1 to 4 ratio, 80 schools adopt this ratio. These EPs may visit these schools more frequently in terms of the number of days.
Those schools have students, more students who have the need. The EPs will visit those schools more often. What about other schools? What is the ratio? Non-SEN, they are all ordinary schools. It really depends on the number of SENs. Some 1.6, some 1 to 6, some 1 to 7, some 1 to 8, depending on the actual situation. Now, the policy address stated 1 to 4, so you don't have enough EP. How would you, when will you achieve the target? It's hard to say. Now, we are working with the tertiary education institutions to enhance the number of training places, and if that can be done, then we can meet that target earlier. Next, Mr. Yu Xiwing. Well, students are mature and they're easily influenced by their peers and the families and also the internet in particular. Those who are mentally weak will easily prone to problems. The teachers are very important. They can observe their students. Para 10 on professional, rather page 10 on whole school approach. You want to encourage them to adopt a whole school approach, but you should demand them. If you encourage them, they can do it, or they can not refrain from doing that. Can you achieve the target? Whole school approach. And then there are 3 tiers of participation, or 3 levels of participation. Will there be training to teachers, in particular class teachers, so that they can help in spotting students with abnormal behavior. Now they have had basic training, then they can assess students who are more vulnerable. As for the second tier, will there be a professional or a dedicated person to provide support? So the first tier has identified the problem, then there is a professional assessment so that that particular student would be observed by a dedicated person, and then there will be professional support if need be. And when it comes to support on the third level, I think it is more professional. I want to know in each year how many students are referred to support on the third level. And after professional assessment and support, are there any so-called accidents rate of that? Well, the EB will answer the question concerning the three-tier support, whether it is caring for the SENs or who have mental issues. For those who are vulnerable on the first level, the school will provide many school-based activities or schemes, and the students are helped to strengthen their resilience. As for dedicated persons who care for students of the second tier, we have started a systematic mental health course. Teachers participate, and also a teacher in each school is asked to attend a higher level and advanced course. Apart from this, we'll also have resources for schools in respect of caring for students of mental illness. We have allocated we have given a resource menu to the schools, and there are also seminars and talks. Every year we work with the DHA to organize such courses and talks. We hope to enhance the care for students. As for more serious cases, I do not have the number in hand. Now they will be provided help, but the clinical psychologist will be assigned, and if need be, a psychiatrist will also be assigned. There is a professional team to help the student. Chairman, I think the administration has not answered my first question positively. You say you will not, is it just a demand or a general demand, just like an encouragement? I hope that you can provide a numbers to me concerning the referral to experts or specialists. Have there been any accidents? If there is, then the referral may not be effective. Concerning the third tier, or tier 3, how many students are in tier 3? Well, we'll try to find out whether we have any information. There should be. It really depends on the definition. As for tier 2, concerning the add-on support service, preliminary 18 hours, advanced training 30 hours. Is it the case? Is it what it said there? So advanced training is just 30 hours. 30 hours of training is regarded as advanced. And in each school, there is only one teacher who received that advanced training of 30 hours, and they think that's a big deal. Only 30 hours of training. Well, we started this year, and we'll watch the progress, and we will also consider the views of the service providers. Apart from this training, there are also specific training courses to help students with emotional problems. Now, usually one subject takes about 45 hours in the university, and so it's just after taking 30 hours, then you become an expert. Now you say it is an advanced training, but the teacher only has received 30 hours of training in psychology, and how can that be advanced? Well, next, Chen Pui-yi, and then Ann Chang, Fernando Chang, and then Cheng Chung-tai. Chairman. Dr. Chen, yes, I appreciate this meeting very much. Adolescent health is very important. In fact, the Education Bureau's policy affects adolescents' health. Now, concerning integrated education, as SENs are learning together with normal children, that's a good thing. But if the mainstream schools are not able to deal with students with autism or ADHD, then it will be a problem. I have come across cases in which a senior teacher is following a single student all the time, or the SEN is put in a classroom to study alone, and also the SEN is forced to take medicine. Now, in the HA, there is no dedicated resources for child psychiatry. You don't have the resources. So I want to ask the EB concerning autism, students suffering from autism who have normal IQ, if they cannot be integrated into the mainstream schools, why can't there be special education places for them? The next question is for the HA. Now, if a student suffering from autism has to take medicine and admitted to hospital, how much is expenditure on them? And the third question, because of time constraint, you may not be able to answer that. I want to ask the administration concerning the places, special school places for autistic students, and expenditure on HA by the HA, which is more cost-effective. What is more ethical? You give them medicine, or you put them in the HA, or you provide suitable care at school. Dr. Yu, concerning the autistic patient, the expenditure on autistic patient, we don't have the number in hand, and we do not specifically conduct statistics on a particular illness. They don't have the breakdown. So you're misleading us. You don't have the breakdown at all. Do you have CNA psychiatrist? I think there's a misunderstanding. In terms of the specialist level, child and adolescent is not a subspecialty in medicine, but in the HA we do have child and adolescent service, geriatric service, adult service, so on and so forth. In psychiatrists, there is a distinction among age. I've asked the question because I am well prepared to ask your question. Please answer in writing. Every year, how much is spent on child and adolescent psychiatric service? Yes, we can check the number. The Education Bureau. For normal students with normal IQ but having autistic autistic problems, why can't they be provided with special education if they cannot cope in the normal schools? Now, students with autism are hard to deal with in normal schools, but through suitable pedagogic strategy, that can be handled. Their social skills and emotional skills can be helped in the normal schools. So we provide additional resources so that schools can get teaching aids and more teachers to help. And we are developing such educational resources. We work with NGOs to find ways which are effective to help SENs. As for senior primary, or rather primary schools, we have identified more resources and we will distribute to the schools. And we are now also working on the secondary schools. If they have normal IQ and if there are problems with their social skills and adjustment, then with suitable training, the students can improve and they can adjust to a normal school education. But in some extreme cases, they have to take medicine, they have to be hospitalized, and yet you still put them in a mainstream school. And therefore, there are special examples of taking medicine, hospitalization, or even suicide. And you say the students should be kept in normal schools. That's why we need this meeting to deal with the problem. Have you heard this? We're talking about serious cases, or you may call extreme cases. But can integrated education solve the problem? Well, in the transition, whether it's in the education system or medical and health system, will try to help. And if they can be calmed down, they can be cared for in the schools, and they can learn and grow with normal students. But there are many such special cases. There is enormous pressure on the teachers and in the school at large, not just the students.
Just now, Dr. Chen asked you, Dr. Choi, that about the healthcare expenditure on student health services. Well, I can in fact help you. Our GDP spending on psychiatric services in Hong Kong is 0.24%. In Australia, 0.88%. What the difference? That's about psychiatric services. For adolescents, it might be 0.0 something, even a more staggering figure. And Mr. Lai, every time we met with parents of SEN students, in fact, a week ago, I met with some parents in Tai Po. When they talked about their experience in school, very often they have strong views. The teachers may not know about SEN. They might think that the students were just being naughty, and they might repeat the same orders very loudly in the hope that they would hear them. But in fact, the children are autistic, and it's really disheartening to see for parents. I hope that you will pay attention to these cases. I don't know whether this is deliberate from the teachers, but at least it is not desirable. I can give you more information on the parents in Tai Po later. Chair of the panel on education, Dr. An Chang. Chairman, I have this question about the students or young people committing suicide. I want to know whether you have any preliminary analysis on the causes, on the background. Well, I suppose the answer would be there might be different causes, and people come from different backgrounds, etc. And that's the conclusion made by the made in the final report on prevention of student suicide. Who would take the question? Education. Well, as mentioned in the report put forward by the Committee on Prevention on Student Suicides, indeed there is a variety of causes, and it is not as simple as what the media and the public understand. And we do not have information on this regard. What about their background? Do they mostly come from, say, broken families? Do you have information about this? I'm sorry, Dr. An Chang, you're referring to broken families, right? Because according to some information that I have, the majority of students committing suicide actually came from single-parent families. I don't know whether you have this information. We don't call it broken families nowadays. Pardon me if I correct you. You cannot say that marriage, a two-parent family, is the end point. So you can call it a single-parent family, but not broken family. All right, single-parent family it is. As we explained just now, we do not have information in this regard. I'm sorry to say that, Chairman, because in the end of 2018, I understand that another report was submitted with recommendations to the Chief Executive by this Committee on Prevention of Student Suicides. Is that right? In fact, the task force, rather, would be reviewing the recommendations set out in the final report in 2018. So I'd like to have more detailed information from this task force, because after diagnosis, you need to prescribe medicine to treat the problem. So can you tell us what we should pay attention to, what background of students, for example? We have this joint meeting today, and we do believe that recently adolescent suicide rates have increased, and that's our concern. We received 32,000 such cases last year, and that's under the HA, and we don't know how many cases more there were not under HA? And what about cases not diagnosed, not identified? We don't know. So I think we need to pay more attention. Now, I suppose the other figure would be available, and that is, let's say, for adolescents between 12 and 17 years old, over the past decade, about the percentage of suicide cases. Well, I want to know whether the number has increased in the past 2 years. Do you have a global index? We do not have this information, but we'll go back and check. We do not have the information at hand, Chairman. Well, perhaps you should assign this task to a colleague to make sure that after we have this perception, we are sure we know whether this comes in a cycle or what. Has it to do with social atmosphere, for example? We need to conduct an analysis. My other question is this, about one social worker per school. It only applies to secondary schools, right? Would you consider expanding the scheme to cover primary schools as well? Because nowadays, our children are quite mature and they have very broad knowledge base. They Google a lot, and yet they have very weak analytical power. Young primary students nowadays would access the internet to look up information, etc. But we need to provide more support to them. Would you consider expanding the one social worker per school scheme to primary schools as well? Let's leave it for a follow-up because your time is up. I think that Dr. An Chang might be asking for this figure. In Australia, we do have the figures. 1/4 of the young people in Australia face mental problems, and 3/4 of their students' death relates to student suicide, and many episodes of mental illness occur before one reaches 25 years old. These are figures giving you a picture of suicides among adolescents. I suppose this is what Dr. N. Chang is asking for. Well, Chairman, just now I talked about primary schools because mental issues are often triggered during early adolescence, say between the age of 11 and 12, and if no proper counseling is provided, then very likely there could be hallucinations, negative thinking, things like that. I think it's worthy of thought, but we also need to have more figures specific to Hong Kong, because for the past decade, if you could have more information, it would be better, so that we can analyze the situation in society, the circumstances leading to the occurrence of these cases. I think these figures are absolutely necessary. Dr. Fernando Zhang. In fact, Dr. N. Chang referred to a number of questions, and the information is actually provided in the final report. However, it is said that there is no direct correlation between student suicide cases and the education system in Hong Kong. In fact, there was a response relating to 3 levels, that is universal, selective, and indicated levels. By selective, it means that students' education should be enhanced to increase their resilience against and also to prevent student suicide. Well, I am chair of a subcommittee on rights related to children in terms of how they deal with pressure, including the education system and schools. According to the children, they do not even have time to have enough sleep. They have long school hours. They have very short breaks at home and in school. And during recess or even lunch hour in school, they would need to do homework or deal with school affairs, and then they need to revise homework whilst at home, and during the holiday they're given extra work. At the same time, the Education Bureau has a number of schemes, Joyful and Hong Kong Campaign, and also Happy Kids Charter, but they cannot really enjoy their time, and even their school bags are getting even more heavier. The education policy is that they target high-risk students and families. They provide training for parents to be goalkeepers or gatekeepers. But many of these parents are actually working parents. Both of the parents in the family need to work. Now, Dr. N. Chang asked about single-parent families and this correlation with student suicide. According to the report, 1/4 of the suicide cases related to families with only one parent, or a parent being a divorcee or a widow. And family-friendly employment practices should be adopted, such as standard working hours, flexi working hours, etc., so that the parents would have work-life balance and would allocate more time to look after their children. Unfortunately, apart from this paragraph in the report, these points are not included in the recommendations, because they don't see a direct correlation between the points and the terms of reference of the committee. On preventing adolescent students and student suicide, the HA has a CNA psychiatric service. In 2011-2012, it dealt with 18,900 cases. Last year, it dealt with 32,000 cases. So it's an increase of 70% in just 5 years. I don't know whether you have increased your manpower by 70% correspondingly. Perhaps you can tell us. There is also a collaborative scheme involving education, healthcare, and social welfare sectors. You have EPs visiting schools, treating some 100 or 200 students with high risks. How is it done? And only about 2% of all schools in Hong Kong take part in this program. How much help does it offer? Can you tell us, in terms of the different levels, universal, selective, and indicated, what does it mean? And that's in your final report published in November 2016, recommendations on universal, selective, and indicated levels. Can you respond to that? I think, Doctor, you can explain about HA services. Now, on these fronts, we're working on them. In terms of universal level, we encourage schools to take part in the programs, and the schools have reacted positively to the promotion of mental wellness in schools, and also to raise students' awareness on mental health and the knowledge on where to seek help. During summer, we understand that the schools have reacted very positively to applying for funds for Joyful at School campaign. What about the Joyful at School campaign? How many schools are covered? As of the end of November, we approved 400 applications from schools. So altogether, primary and secondary schools, with secondary schools being the majority, about 400. Apart from taking part in the Joyful at School campaign, there may be bridging courses for Form 1 and Form 4 students. In terms of alleviating pressure, we note this issue through various channels, be it school curricula, school circulars, school visits. The Education Bureau works with schools to alleviate pressure on students so that students will have more time and space to take rest and to learn. And we also have a task force on the review of school curriculum, which will review the school curricula of primary and secondary schools. They will also involve stakeholders and listen to views so as to give students more space and time for whole person development.
There are 400 Joyful schools. We have received 400 odd proposals. Some schools are working together. We have approved 400 odd, over 400 schools. Are you happy with that? How many schools are there in Hong Kong? Well, we don't have a specific target. From April onwards, after we increase the cap of subsidy to $200,000, and after allowing cooperation with NGOs, the response has been good. We have briefings for the schools, 400 odd schools. We think that's a reasonable response, and there are more schools applying. Now, are you aware of the problem raised by Dr. Cheung? Now, the final report in November 2016 referred to policy matters like flexi hours and maximum working hours. But in the recommendations or the action, recommended action, nothing has been done. But there is no such recommendation in policy aspects. So in that meeting chaired by Dr. Law, will you review the report once again, not to conduct a study, but re-examine the recommendations of the report or contents of the report? Content of the report, which was in the content, but has disappeared in the recommendations. Will you revisit that report? Now, the HA has not answered the question on manpower. Dr. Yu, in the past few years, the government has put in resources on psychiatric service, including CNA psychiatric service. In 2011-12, 2016, 2017, and also in other years, specialists have been added. But of course, the manpower cannot be augmented up to 70% because of the limited supply of doctors. We are able to when we are able to see the increase in number of doctors, we'll consider how we can put in more resources. Can you give us the actual numbers in terms of the doctors and also other healthcare personnel? Concerning the review, the curriculum review task force, I hope the task force will consider providing space or creating space for the students. Say, can the schoolwork, homework be reduced? Can there be standardization of learning hours or standardized hours for doing homework? Now, the guideline had already disappeared in respect of homework. There are views requiring the government to do something about it. In fact, the research section of the LegCo is conducting a study on learning and mental health of children. I hope members will pay attention to that as well. Next, Mr. Cheng. The majority of members, I believe, will agree that the Education Bureau is the chief culprit. I'm of the view that the DH or the HA or the FSB, FHB can do a lot of change if there is no change in education policy. Students have special education needs. The students are suffering from autism, but they cannot be integrated with normal school education. But why you still force them in the normal school system, and why you so force their teachers and parents to deal with the problem? In fact, the children are not able to adjust to the mainstream education system. The DH, the HA, or the FHB should not be forced to clear the mess. That is unfair to them. The Education Bureau has not conducted any review on integrated education, nor has it faced up to the problem. I am concerned about the report which was published in April. Among the primary school students, we still have a situation which is unclear in terms of child education service, child psychiatric service. Say, for depression, for and autism or other anxiety and the like. What is the expenditure on such illnesses? Now, obviously, students suffering from anxiety and depression among primary students are more serious than we have expected. They cannot sleep well, they are crying, they wake up in the middle of the night crying. That's how children or small children react. Doctors consider that they're symptoms of anxiety or depression. You may not have a child psychiatric specialty, but can you have the breakdown of the numbers so that we can assess how things will be going in the next 5 years? Now, in Australia, Chairman, you will refer to 8%. In Hong Kong, 0 point something. Australia, they are going to add more resources, but we don't have the statistics in Hong Kong. Concerning rehabilitation of mental patients, in particular those among the university students in their 20s. Some may suffer from psychosis. In general, it is a mental health problem. Now, according to my experience in the universities, I've noticed that the problem is getting more serious. In each year, some students have to suspend their study. It was rare in the past, but now we have it every year. We cannot say that it is because of a bigger population base, and therefore among those who are admitted to universities, more who have mental problems have been admitted, and therefore they have such onsets. Or is there a kind of mental illness which will have its onset in the 20s? We don't know that. We need statistics. A student may have rested for a semester, and he can recover, and then he can continue and finish his whole curriculum. But they are stigmatized. And students, these students are referred to the student counseling unit, but they cannot. The section cannot cope with that. Now, they may have the students may have an onset, say in their 20s, and have recovered, but they are not able to get jobs, or they have difficulty in getting jobs. And how can you help them? And there is no, at present, there is no mechanism to help them. I hope the administration can address this. I'm going to listen to. I'm going to attend a complaint section meeting. Well, in fact, it is an analysis rather than, and also a reminder rather than a question. The Auckland Social Service in August published a research result. It's really worrying. That's a survey on secondary school students in 15 districts and 15,000 students. And in fact, the problem of anxiety and depression is of a high proportion among the students. 37 schools, 15 districts, and 15,000 students. Yet, 0.24% of GDP is given to psychiatric or mental health service. Why is it so low? Australia, they had 0.88%. Now, Mr. Xiu, concerning adolescent mental health, is an issue of common concern. In recent months, the chairman, Mr. Xiu Ka-chun, arranged a few protests in respect of youth suicide. We cannot ignore the problem. The FHB, the EDB, and the SWD also have representatives attending our meeting. The teachers and the SWD are in the front line. Social workers at school are in the front line contacting students. Now, concerning the social workers, when they contact the students, how do they understand the situation of the students? And if some problems identified, Can there be any referrals made? Can the students be referred, say, to the bureaus and also even experts? The Education Bureau or the SWD on referrals. Now, concerning the secondary schools, the SWD subvents the school social workers. In the year 2000, we have one school, one social worker policy. In 2012-13, we've added more resources. Therefore, there is on average 1.2 social workers per school. The social workers have close contacts with the students, the teachers, the discipline teachers, and the school authority. If anyone at school is aware of any problem among the students, or if the student comes forward, then the social worker can intervene. The social worker doesn't just look at the student per se. The social worker also looks at the family and also the problems at school. If need be, referrals can be made. Say, referrals can be made to integrated family service center, and if situation is more complicated, the student can be referred to a psychiatrist or referred to a psychologist, and need be referred to a psychiatrist of the HA. So the referrals are made according to the situation, and the social workers also are aware of the resources available in the community and find suitable services for the students and his or her family. Concerning the referrals, do you have the numbers in recent years, and is it a rising trend, or is it stable, or what? I don't have the number in hand. I believe there are many referrals. The problems encountered by students are multifaceted, and the problems cannot be resolved just on the school level. Referrals are made. You have only 1 point something social worker per school, and students. There are more students having problems. Will you add more social workers? We are keeping an eye on the situation.
Now, we won't rule it out. After the review, if need be, we'll increase the number of social workers. We keep this in view, and we'll also work with, other departments in terms of policies, measures. If school social workers are involved, we'll definitely keep it in view. I think Mr. Xiu's concern is the departments passing the buck among each other. After identifying problematic students, how should the departments work together? Because we know there is a clear division of work among departments. And very often there is an coordination problem or overlapping of resources or omission among the departments. This doesn't just happen to youth suicides, but also other issues. So I think this is Peter Xiu's question, especially for collaboration among departments and the dialogue between the Social Welfare Department and the Education Bureau. Any response from the Education Bureau? Madam Kwok just now talked about social worker support. At primary school, emotional problems may not be a significant issue. Class teachers usually would look after children in terms of their learning needs, and if there is support needed to deal with emotional issues, the school counseling professionals will be informed. And under the school grant system, schools would employ social workers, and we do provide support to students, and we have regular communication with the Social Welfare Department. If need be, service will be provided to students. Dr. Lo Wai Kwok. Now, today's topic is on mental health of adolescents. But let's take a broader perspective. Healthy development of adolescents. There was recently we saw the case involving the brutal mutilation of a 12-year-old girl. This is disheartening and upsetting. Very often we have bombs in our society, and the departments concerned have absolutely no knowledge of these problems. And we have unfortunate incidents one after another involving families, tragedies, and the well-being and the personal growth of young people are affected. Only subsequently will departments know about the bombs in the society. I think we need to reflect on ourselves and find out the cause of these problems and how we can make improvements. I recall when I was young, when I was in primary school, and I did not study in any prestigious primary school. But basically, teachers had an idea of the family circumstances of students. And back then, parents would be proactive in approaching schools and teachers. We were all from grassroots families. With social developments, sadly, there was a wider gap between people. We used to look after each other as parents and teachers in the past. So I'm not criticizing any department. I'm just saying that we should all join hands to solve problems. Everyone, every family should consider how we can contribute more to that. How do we keep social harmony? We had this in the past. Now we're so isolated. I suppose we don't even know the surname of our neighbors. In the past, when there were problems, neighbors would offer help. I'm not talking about any specific case. It's really a recent tragedy that we witnessed, that we consider how we should all join hands and how we should take collective effort in the community so that we have a harmonious society with people looking after each other. Thank you, Dr. Low. Well, when this unofficial support network no longer provides support, we need to rely on official channels such as schools, social workers, the government. You talked about harmony in the neighborhood, mutual help, etc. But I think a lot of members already covered this point. Times have changed. Our society has changed. We need government policies and measures to do that. We have Michael Tian, Kwok Wai Keung, and Ip Kin Yun waiting to ask questions. Mr. Michael Tian first. Thank you, Chairman. I have a question on the 40,000 SEN students in primary and secondary schools. They mostly suffer from ADHD and autism. I have 4 children, and I've often worried about their health, especially ADHD, attention deficiency hyperactive disorder. Autism is even a bigger issue. And I think friends around me also have children suffering from autism. They have means. So on the other hand, for families under financial pressure, they need professional help for the children, such as speech therapists or physiotherapists. I want to know how many special sessions are offered to these children. For example, 1 session per week in school, each lasting for 20-30 minutes. How much help can they give? At the same time, we heard about graduates having taken up such courses, being unable to find a job in Hong Kong, and they need to turn to Macau. I want to know whether it has to do with lack of resources. You have not recruited all of them, all of these graduates in Hong Kong to help students with special educational needs. I want to know whether this can be done through schools. We have grassroots families facing financial hardship. They can't handle them on their own. And if we only rely on the services provided by schools, one session per week is not sufficient. You should deploy more resources on families. You can have a screening mechanism. Eligible families with diagnosed children with financial hardship, can subsidies be provided to these families so that they can get the service they need in the private sector? I don't think this is purely a matter relating to the Education Bureau. And let me also refer to another point. I have 3 grandchildren. Two of them aged 3.5 and one aged 1.5. I noticed that whenever I give an order for them to do anything, they might get really agitated. And if there are ways to get their attention, they would, on the other hand, be very touching. So I think it has to do with cultivating their interest. And the education system is such that in primary and secondary schools, we do not target at cultivating students' interest. We place focus on enhancing the level of knowledge. And I also entertain students in the mood council meeting. They do role play sessions, and then they prepare scripts. And very often I would just ask them to discard the scripts. Just move a motion using a live example. Say you can move a motion to lengthen the recess of 10 minutes in school to 20 minutes. But the compromise is that you need to be 30 minutes. You need to stay in school for 30 minutes more. And then they just got very excited about the debate because we are moving a motion on a matter close to their hearts, something that they understand, whereas the original script is something beyond their understanding. So when it comes to pre-primary and primary education, we need to conduct a review. Is it about pursuing knowledge, or is it about cultivating their interest in learning? Very often they don't they can't be fitted in the mode of teaching and learning. That's why they give up. The first question is simple. It's about money. The second point, I'm perplexed as well. All right, for the first point, Chairman, we can look into that about primary schools. For students with speech problems, we have the school grant for schools to hire speech therapists to provide on-site service. The objective is to help students with their speech problems such as pronunciation, fluency, etc. The speech therapists provide service, and it also ties in with the teaching effort of teachers, because language education is very important. And they all work with teachers. We have put in place this program for a long time. It's very much welcomed by the sector. You spend 1 minute explaining a simple sentence that I said at the outset. I talked about the current situation. It is not sufficient. I asked whether we can have more subsidies for them to engage the service in the private sector. The number of training sessions for each student varies. It's up to the speech therapist. For those with more moderate situation, shorter sessions may be needed, and it has to do with cooperation between speech therapists and teachers. What about basing the service on families. Take a look at the service needs of families. Based on the level, you can then set an amount, and then the family can procure the service in the private sector. You cannot always rely on the government. Well, as we explained just now, the philosophy is for the speech therapist to work with the teacher so as to maximize the learning benefits. I also received a comment saying that there is a lack of service by speech therapists. Parents think the sessions are effective in school, but then it would take 15 minutes for students to go from one classroom to another, and then the sessions are too short, just 30 minutes, and the student will need to wait for another session next week. In the private sector, however, the fees are expensive, maybe $600 or even $800 a session. There are many families who cannot afford the service. Apart from the Education Bureau, the Social Welfare Department might equally face the same target users. That means young people with, SEN students, and also you're providing additional grant to schools with SEN students, right? Some $10,000. I'm not quite sure. I'm sorry, Chairman. I'm still puzzled. He's not answering my question. I ask why you won't consider letting the private sector take over these cases. You can allocate resources to the families on their circumstances. Don't just rely on the schools. Your response now is that it is not necessary and that the schools can fix all the cases. Or are you going to consider my suggestion? I don't quite catch you. Of course, we definitely consider members' suggestions. But at this moment, the model is effective because in terms of language learning and speech therapy, it is effective. Why do you think it is effective? It's problematic. There is a manpower shortage. One session per week. Each session spanning 20-30 minutes. Do you think it is sufficient for students suffering from speech issues? Well, it depends. Well, it's really difficult to say. It depends. A session is so short, 20-30 minutes. If it is on the if it really depends on the students, then let's just scrap the service once and for all. We have a number of members, ending with Dr. Elizabeth Kwok. Let's start with Mr. Kwok Wai-Kang.
Thank you, Chairman. Many factors are related to development of young people.
心嘅內容，因為我相信呢，今時今日嘅
Education is an important aspect. What is now being learned by a primary school student or secondary school student is different from what I learned when I was their age. They are facing globalization. They are facing many challenges. Young people face greater academic pressure than us when we were young. Now there is a need to broaden our view. And it's also related to the economic situation and also industrial structure. Now, success is measured by a degree or a doctorate. At the same time, people attach importance to grammar school education. And people attach importance to academic achievement among young people. People do not measure success by, say, whether you can cook a good dish, whether you become a good chef. Now we're talking about equality of all jobs. One can be both outstanding academically, and also outstanding in terms of skills and other talents. Now, if somebody doesn't want to go down the academic stream, is there any way for him or her so that he or she can excel and be recognized? I have not seen that at present. In Germany, they have a two-pronged approach, the academic stream and also the technical stream, and they are given equal respect. The present value system just impose pressure on young persons because they are only recognized by their academic performance. They are more worried nowadays, and they have greater emotional problems. I think society has to change. The family has to change. Without such a fundamental change, and with greater competition, there will be more bullying cases, and there will be more tragic cases. I have not heard from the departments that they are now providing the best service, and that is everything's perfect. Well, you just come up with a list of services and say they are all there, and then we're just going nowhere. Even if we put more questions to you, the problems cannot be solved. I really want to hear from the departments concerning what areas have room for improvement. Well, that's what we want to have. We don't want them to be defensive. If you need more funding to make up for the shortfalls so that you can provide a better service, we're willing to do so. And we seem to have touched on that rather infrequently. Next, Ms. Ip. The family and the school are important elements in adolescents' health. But I will not talk about the family first. The school can increase or reduce the mental pressure of students. The member earlier has given his view. The members have given their views, and I want to refer to the Secretariat. When the students come, we have mock meetings and mock debates. Mr. James Tian referred to policies which are far away from them, and the students are not interested. But Mr. Tian gave an incentive, gave another topic, say whether they wanted to have longer recesses, or they had in exchange for later time for leaving school. That's a hard choice, and the students are interested because the issue is more close to their hearts, and they understand the problem. When the students come, I don't talk about recess with them. I talk about penalizing for littering. Now we want to link up the issues with the daily living of the students, and we should not put students in a straitjacket. TSA is an example. You put a Hong Kong standard on all students. You measure that standard. You measure each student according to that standard. If that puts pressure on the students, then the students suffer. They have lost themselves. They are working for the standard. They're working for the target. The exam is not student-oriented. The TSA is not student-oriented. The HKPTU did a survey this year. The administration has yet to announce whether there will be a TSA next year, and all the schools are now, or rather 40% of the schools are now training their students for that. And if they are going to have that assessment, then 80% of the schools will find that will add to the pressure of the schools and students. We shouldn't do that, and we should try to bring relief to the students. The school system is creating pressure on the students. I want to ask the EDB whether it has any way to reduce the pressure on students through the school system or through amending the school system. It goes back to the TSA. Everybody is keen about it. The research outcome is very important. 40% of the schools are already training the students. It's not just the TSA. TSA is just a typical example, and there are many aspects of the school system which are adding pressure to the students. Mr. Lai, we said that we hope to help the students to have a whole person development, and we want to reduce the pressure on students. We want to provide more room to students so that they can learn and develop their own potential. I refer to a task force which is now reviewing the curriculum, the school curriculum. Now they will listen to the views of the stakeholders and work on the review of the curriculum. Like Mr. Yip, we visited many schools, and different schools have adopted different ways to allow the students to use their time. Say they have a common reading time. They have, before the morning assembly, they put students together and then give them time to read without increasing their pressure. You say you conduct a review on the curriculum. I hope that the school curriculum review will also cover mental health of students. You need to embrace the difference among or variations among students. I'm worried that you are moving towards standardization rather. I will exercise my power as the chairman to extend today's meeting by 15 minutes, so we'll end at 1:45. And I hope the officials have heard our colleagues. It's not about how to improve, how the department should improve. I think the LegCo should also improve upon how we receive the students. The debates, the mock debates and motions should be more attuned to the daily lives of students. As for recess and time for leaving school, a recess should be a true recess. There are 2 recesses, 10 minutes each, but the recesses do not allow the students to, during the recess, the students are not allowed to move around, nor the students may be allowed to do homework. And the lunchtime, and for the lunchtime, half of the lunchtime is devoted to supplementary classes, but they really want a true lunch. I hope you can pay attention to that. Next, Ms. Quat. Thank you, Chairman.
即係學生嘅精神健康咧，我諗
On mental health of students or adolescents, this is a common concern. There are many factors contributing to that: the personal inclination, school education, family education, the overall atmosphere in society. Many factors. As for nurturing of the individual, there is need to build the resilience. They can find their own direction in their life. School education and family education should be stepped up in these areas. And we've seen that the administration and schools have done a lot. There are programs on parent education as well. The question is how many parents are contacted and whether that's adequate. Let's turn to the school. The students are busy with their academic work. Adding positive view towards life is something necessary, whether it is during the school time or in after school activities or extracurricular activities. Parents don't have time to attend all the meetings proposed by schools. Maybe you should make use of the smartphone. Say you have more attractive short videos for the parents and send the videos to parents. Would that be more effective in parent education? You need to adopt new approaches. I know you organize seminars, but parents have to work and they have no time for the seminars. So you cannot get a message to many parents. They care for their children, having a quality time, not just watching TV together, talking to their own children, being a good example, all can help the children to build a positive attitude towards life. And all these cannot be achieved through a seminar or informing them to come to a seminar. Long-term effort is needed. New technology is needed, new media is needed to get the message through. The LegCo also has a responsibility to provide a better, larger system for the young people, give them more positive energy, give them more positive messages. And that's a message from my heart. If this council can be more peaceful, rational, less clashes in this council, less antagonism in this council, the overall atmosphere in society is more positive, then young people will be provided with better environment to develop. Members of this council should work hard. Your words and deeds are widely reported in the media.
選取嘅方法咧，其實
So about the word you use, the way you go about something, it creates impact on society as a whole. So at the same time we're demanding the government to improve, we also need to be more demanding on ourselves. Thank you. Apart from me, I'll end the first round. Second round, Dr. Fernando Cheung already indicated his wish to speak, but let me finish the first round with my turn first. I have 3 comments to make. First, on mental health, I don't think that it is all about the policies. And in fact, what we need is, say, school workers in primary schools, like Dr. Helena Wong said, we need to regularize the arrangement. The community also agrees that we need 1 social worker per primary school. I sincerely invite the administration to consider very carefully this suggestion. Stop putting up excuses, because problems are now emerging earlier in even primary schools. Many problems already occurred in primary schools. It's not just about playing truant whether a student wants to go to school. At the primary level, there are more complex problems. We therefore need to allocate resources more urgently to improve services at the primary level. And also at the Advisory Committee on Mental Health, perhaps for Food and Health Bureau's reference, there are 23 members from the healthcare and social welfare sector and layman members, but no representatives from users and self-help organizations. Self-help organizations play a very important role in the arena of mental health. In 1995, a long time ago, the government published a white paper. In this white paper, you acknowledged the role of self-help organizations. We hope that for the Advisory Committee on Mental Health, we can have a representative from user groups or self-help organizations. It's just a humble request. I'm asking for 1, not 2 or 3, which I still believe would be reasonable. I just want to break through this bottleneck. There should be a representative coming from the user groups. And the third point is this: we have $3 billion reserved for mental health initiatives. I'm not being greedy, but I hope that $100 million or several $10 million can be allocated to self-help organizations to promote their development, because their hands are tied. They are not major organizations. They may be running on just a few dozen people as the establishment. Now you have 30 organizations, 40 organizations, all sharing the same pool of resources. And over the past few years, only how much? $300,000. The same pool of funds for all the self-help organizations. It has remained so for the past few years. Why don't you inject more to help the development of these organizations? Well, even for building university dormitories, you could pay, billions of dollars to pay off the debt. You want to promote development of these organizations as well. So these are the 3 comments for your consideration. Under Secretary, do you have a response? Thank you, Chairman. And let me supplement on the composition of the Advisory Committee on Mental Health. We have members who were users of services. They come as a peer support group user, and we also have a user, a member from another group, and also some other organizations. So you'd like to clarify that you have representatives of users on the committee, right? But still enhance the user group engagement, please. Next, second round. Each may be given 4 minutes only, because we're supposed to adjourn the meeting at 1:45. Dr. Fernando Zhang and Elizabeth Quat. Dr. Zhang. Thank you, Chairman. I agree strongly with you, especially on regularizing school social worker in primary schools. Nobody has answered this question. I look forward to the response. In the interest of time, I'll be succinct. What is hurting most is the waiting time for child and adolescent psychiatric services. In 13-14, the average waiting time was 34 weeks. And then the figure continued to increase, 45, 58 weeks. Now it's standing at 69 weeks, as I heard today. This is really hard to palate. In NT East, we're talking about 130 weeks. Dr. Yu said that we'll make progressive improvement. But in fact, the situation gets worse. I asked the question 10 years ago. The waiting time was 4 to 5 weeks. Now it's standing at 69 weeks. You said that you're increasing manpower progressively, but the more manpower you have, the longer the waiting time it is. Do you have any plan to improve things? If it goes on like this, shouldn't you change the service model? in terms of diagnosis and early counseling service. Perhaps instead of engaging a psychiatrist, you can engage other professionals so as to gradually address the problem. And you need to tell us your plan on cutting the average waiting time. On school educational psychologists, the ratio is 1 to 4. It is also proposed in the policy address. It is said that you will regularize the scheme in a timely manner. What is meant by in a timely manner? Give us a timetable. We have 900 schools. When will you promote the ratio of 1 to 4 to all schools? At present, only 80 schools enjoy a ratio, the same ratio. Can you give us a timetable? 2 questions, Dr. Fernando Zhang. School social worker in primary schools, EP's ratio, and also, yes, the waiting time. When will it be reduced to how much? Give us a plan. Education Bureau. For counseling service for primary school students, we have been improving the school to, EP to school ratio. We'll continue to listen to the views of the sector, and we'll also keep in view needs of schools. It also has to do with the affordability of the government and according priorities to different policies. I am going to bring your view back to the colleagues concerned. Regularizing school social workers in primary schools. You've heard this for so many years. You still decide not to accept it? We're still listening to members' views, considering members' views. As for the school's EP, manpower is rather tight, and we do encounter difficulty in our recruitment exercise. We therefore take a progressive approach. This year, 80 schools have participated in it, and it's difficult to have a concrete timetable. We're discussing with the TEIs to step up training so that we have more graduates becoming EPs. Well, Chairman, I think the training goals are very clear. They can definitely come up with a timetable. And also for the Association of School Psychologists, according to them, they have sufficient manpower. I've clearly expressed a view to the chairman of the association. After the meeting, you can get a deeper understanding. We're supposed to adjourn the meeting in 5 minutes' time, so over to you, Dr. Quat. Under Secretary, about the CNA psychiatric service waiting time, it is drawn up by the Bureau as well as the HA. I want to emphasize once again that the Advisory Committee on Mental Health will look at all the figures and all the resources and plan how we can improve the waiting time. I can supplement the information later. Dr. Elizabeth Quat. Thank you, Chairman. Regularizing school social worker in primary schools, increasing the number of EPs. We've talked about these issues for many years. I don't understand why you do not put people first. You do not consider our views. We really want a concrete timetable. Can you give us a timetable after the meeting when, say, how many years later, you're going to reach the target that we want? As for waiting time for mental health service, over the years, I recall that when it comes to issues relating to hospitals and the HA, we definitely would discuss the waiting time for CNA mental health service getting even longer. I'd like to know the cause of the problem. Has it to do with manpower or otherwise? Because you always talk about according priorities. For mental health of adolescents, why shouldn't it be accorded priority? If the waiting time is so long their health will be affected, shouldn't you accord priority to that? Can I invite them to respond first? Yes, school social worker and also priority. In the final report published in November, or in April rather, this year, one important topic is on mental health services for adolescents. The report touches on problems and it also makes recommendations. We take a serious view and we'd like to follow up on the recommendations. The advisory committee just held the first meeting in December. We'd like to take this opportunity to emphasize that mental health of adolescents is our key priority and that we need to work on. Starting from 2018-19, there will be more graduates leaving medical schools in Hong Kong, so there will be increased manpower, and for the 3-year recurrent funding exercise, we will factor this in our budgeting exercise. Together, we're also going to step up manpower and training. Do you have a target? How many years does it take for you to gradually cut the figure? I think it takes time. We don't have the information at hand. And I think that this is also one of the key tasks of the advisory committee. So when will the advisory committee be able to give us this target? We don't have a timetable as of now, but we'll do it as soon as possible. Well, Dr. Quad, you should know that we can never ask them for a timetable. But I want one because I have been members of various advisory committees. There should be a timeline because there is a timeline for, say, the advisory committee itself, when it should complete this work. If it is not on the agenda even now, there will never be a timetable. If it's on the agenda already, tell us what item it is. That is, if you want to shorten the waiting time for mental health service, tell us when you will have a timetable ready so that we can chase you up on the timetable proposed. Thank you, Dr. Quad. We just had the first meeting. In our subsequent meetings, we are going to relay your view to the advisory committee and explain to members later. All right, we'll follow up on it definitely. Thank you for summarizing the meeting for us. Today, we'll talk about the mental health of adolescents. It's very rare that we have a joint meeting of 3 panels. Many members ask a lot of questions. But on this topic, mental health of adolescents, we are very concerned. We're going to ask a lot of questions more. No health without mental health. Well, this is in the first sentence in your mental health review report published in April. It is very important. There is no health without mental health. So I hope that this is not just empty talk. I think we should all attach importance to mental health. Lastly, when it comes to mental health, I just now noticed that there is a member on the advisory committee who is an important figure in the mental health sector. She encountered a traffic accident and passed away, and we are sorry for the loss. I'd like to make tribute to Dr. Yao, Madam Yao. She played a very important role in social welfare and also mental health work in Hong Kong. We're sorry for the loss, and that concludes the meeting. Meeting is adjourned.